Good morning to everyone. My name is Joshua Arindavan Suson from Almaj International School, Damam, and I'm in grade 8 Unity. So today I'll be talking about chronic diarrhea. Chronic diarrhea is a diarrhea that lasts for more than 2 to 4 weeks, is considered persistent or chronic. In an otherwise healthy person, chronic diarrhea can be a nuisance at best or become a serious health issue. For some who has a weakened immune system, chronic diarrhea may represent a life-threatening illness. So what causes chronic diarrhea? Chronic diarrhea has many different causes. These causes can be different for children and adults. Chronic diarrhea sometimes is classified on whether or not it is caused by an infection. The cause of chronic diarrhea sometimes remains unknown. Sometimes the chronic diarrhea can be caused by an infection from parasites like Cryptosporidium, Glycospora, Entomibia histolica, Diarrhea, Micropospia, or bacteria like Aeromonas, Campylobacter, Clostridium difficile, E. coli, Plasmodium, Salmonella, and Shigella, or viruses like norovirus, rotavirus, and other diseases. And chronic diarrhea that is not caused by an infection may be from disorder of the pancreas like chronic pancreatitis, pancreatic enzyme deficiencies, cystic fibrosis, and intestinal disorders like colitis, Crohn's disease, irritable bowel syndrome, and medications like antibiotics and laxatives. Intolerance to certain foods and additives like soy protein, cow's milk, sorbitol, fructose, and olestra, and disorders of the thyroid like hypothyroidism, surgery or radiation of the abdomen or gastrointestinal tract, tumors, reduced blood flow to the intestine, altered immune function like immunoglobulin deficiencies, AIDS, autoimmune disease, and hereditary disorders like cystic fibrosis and enzyme deficiencies. So how is chronic diarrhea diagnosed? The diagnosis of chronic diarrhea can be difficult and requires that your healthcare provider take a careful health history and perform a physical exam. These type of tests that your healthcare provider orders will be based on your symptoms and history. Tests may include blood or stool tests, and stool cultures may be used to test for bacteria, parasites, viruses, or generally 3 or more stool samples is collected and examined. Special tests may require to diagnose some parasites if these initial tests do not reveal the cause of the diarrhea. Additional tests may be done including radiographs, x-rays, and endoscopy. Endoscopy is a procedure in which a tube is inserted into the mouth or rectum so that the doctor, usually a gastroenterologist, can look at the intestine from the inside. So, who is at risk for serious complications from chronic diarrhea? The risk of serious complications from chronic diarrhea depends on the cause of the diarrhea and the age and general health of the patient. Chronic diarrhea from some causes can result in serious nutritional disorders and malnutrition. Severely immunocompromised persons, including those with HIV/AIDS and those receiving chemotherapy for organ transplantation, can be at risk for serious chronic diarrhea. Determining the correct cause of chronic diarrhea is necessary in order to select proper treatment and reduce the risk of serious complications. So how is chronic diarrhea treated? So first, remain well and hydrated and avoid dehydration. Serious health problems can occur if the body does not maintain proper fluid levels. Diarrhea may become worse, and his hospitalization may be required if dehydration occurs. And second, maintain a well-balanced diet. So doing so may help speed recovery. And avoid beverages that contain caffeine, such as tea, coffee, and many soft drinks. Avoid alcohol, it can lead to dehydration. So, what are infections that can cause chronic diarrhea spread? Infections that can cause chronic diarrhea usually are spread by ingesting food or water or touching objects contaminated with stool. In general, chronic diarrhea not caused by an infection is not spread to other people. So, how can we prevent the infection of chronic diarrhea? So, always drink clean, safe water that has been properly filtered, and use proper food handling and preparation techniques, and maintain good hand hygiene, including always washing hands properly with soap and water before handling food and after using the toilet or changing a diaper. So stay safe, everyone, and that is my report for today. Thank you.